So there is a relationship between progesterone and breast cancer. It is said that it is seen that high levels of progesterone are associated with increased risk for developing breast cancer, and these high levels can be achieved with oral contraceptive. Oral contraceptive, we mean that for women who prevent to get pregnant, use progesterone to prevent the fertilized ovum to be implanted in the uterus, because the progesterone has a negative feedback loop to the FSH and LH, so it would reduce the progesterone down, and so the menstrual cycle will flush out the ovum at the end of the menstrual cycle. Now lastly, we would see the estrogen. As we have seen in the previous slide, the estrogen was producing normally and then increased during ovulation and then reduced back during ovulation and after, then reduced back when there's no fertilization. It will start to increase with the progesterone if fertilization occurs. So estrogen is a very important hormone for sexual and reproductive development, and mainly produced in women. It is a family of hormones consisting of estrogen, estradiols, and many others. As you can see, estrogen doesn't have the oxygen group over here, and the other terminal group on the other side is diminished completely. So all we could see is the hydrophobic cyclic chains that we have here, what is left in the cholesterol derivations. Now, estrogen function is produced mainly in ovaries, but it is also produced by fat cells, and this is very important, and also in the adrenal gland. Estrogen evolved in the onset of puberty, and playing a role in the development of secondary sex characteristics such as thin voice, breast formation, etc. Now let's look at the function. Now, as we can see here again, the ovulation occurs just before the estrogen starts to increase abruptly. And when fertilization occurs, estrogen levels increases back again, so as progesterone. But here it shows the diagram where there is no fertilization occurring. So it reduces back, and then it starts to decrease again because the corpus luteum didn't receive enough estrogen to keep producing the progesterone. Another function of estrogen is that it plays an important role in bone formation. It's shown as a result of low levels of estrogen in women, they are more at risk of acquiring osteoporosis. Osteoporosis, we have emphasized that in the adrenal. We're going to emphasize that on the adrenal gland. And even in animal testings, we induce osteoporosis by surgery and by excising the ovaries of the female animals. So we take out the ovaries, and then it's just there. The osteoporosis model animal would be done in few weeks, in a week or so. So what I mean by osteoporosis means osteo means that bone, and porosis means the bone is very porous. As you can see in the healthy bone, it's mainly compact. However, in the osteoporosis position, we can see that there are many holes in there. And this is due to the estrogen contributing to the osteoblast cells. Osteoblast forms the bone, osteoclast deforms the bone. It's a cycle, it's normal. However, when estrogen increases, it gives a healthy bone. And if estrogen falls in the level of blood, it would be shifting to this, and the bone would shift to this picture we have, which is the osteoporosis. The osteoclast starts to degrade bone more than the osteoblast starts to form again. Now, the changes in estrogen levels, it increases normally during puberty and also during pregnancy. That's normal because in puberty it will give the secondary sexual characteristics, and during pregnancy it will keep the corpus luteum corpus to keep producing progesterone. However, estrogen falls after menopause, so it stops menstruating. So women stop menstruating. And this reduction could cause complications such as osteoporosis, as we have discussed. This is not the only case. The other case is when there is hypogonadism or diminished function of the ovaries. That's during the embryo development. And another kind is where women get really depressed and they stop eating. They lose their body fat, and we have emphasized over and over again that fat or adipose tissue secretes estrogen levels with the ovaries, of course. However, if they start to lose body fats and become very thin, they are at risk of having low estrogen levels, and in consequence they have risk for osteoporosis. Also, the models which they are appear very thin, they are also at risk. So women in general, women with low body fats, either for depression or for a job, they have low estrogen levels abruptly. Thank you.